And new numbers coming out about monkeypox. A recent study from the Annenberg Public Policy showed 1 in 5 Americans fear getting monkeypox, but don't know much about it.
Yeah, and that lack of knowledge is really impacting one group in particular.
Yeah, Doug Reardon helps us understand the fact and the fiction tonight about monkeypox. He's live right now at the Kent County Health Department. Doug?
Yeah, Max and Josh, monkeypox isn't new. Doctors and experts have been studying it for years. It's very actually closely related to smallpox disease. And while the World Health Organization did say that most of these cases that exist right now in the country are between men who have sex with men, while spreading information about this disease, health officials want to also make sure they aren't spreading stigma.
The majority of cases in the United States are indeed men who have sex with men, but it is because it's transmitted in so many other ways. We can't just put them in one group and think that they're the only people at risk, because they're not.
Kathy Armstrong with the Kent County Health Department wants to spread knowledge about monkeypox, not stigma. Because it's spread mainly through intimate contact, many cases have appeared in LGBTQ circles, but not only in those circles.
To stigmatize a particular population for a particular disease entity, it's not accurate, and it's not fair, and it's really not sensitive to all of us in the community.
As soon as cases started popping up, Grace Huizinga with the Grand Rapids LGBTQ Healthcare Consortium started tracking it and distilling rumors that this is purely an LGBTQ issue.
Cervical cancer is a cancer actually that's caused by a subtype of the HPV virus, and it's passed through heterosexual sex. And we never refer to cervical cancer as a heterosexual disease.
Thursday, the U.S. declared monkeypox a public health emergency, seeing a little over 6,500 cases nationwide. But Armstrong says this likely won't be anywhere near a repeat of COVID-19.
It's given through close, intimate contact or prolonged face-to-face contact. It's not respiratory like COVID is, so it's not as easily transmitted as COVID is.
And there's already an approved vaccine. Michigan does have doses, but says only infected or at-risk people, like the immunocompromised, need to get one. The vaccines are made by a company in Denmark that's been flooded with worldwide requests, so the supply in the U.S. now is likely the only supply until this fall. But the risk is still low as long as people avoid intimate contact with known cases.
People who are just going grocery shopping, out in the community, they're not at risk for it. So people who are immunocompromised and people who have intimate contact with someone with it, those are the people I am concerned about.
There are almost no hospitalizations associated with monkeypox in West Michigan, and symptoms usually subside in 2 to 4 weeks. With schools starting back up in about a month, health officials will keep an eye on it, but aren't too worried about the spread.
We can safely send our kids to school without being concerned about monkeypox being a huge threat in the community.
And while today's declaration of a public health emergency might sound scary, it does open up more funding and potentially more resources, not just for vaccines, but also for testing and treatment of monkeypox here in the U.S. We're live in Kent County. Doug Reardon, Fox 17 News.